So, you've just found out you're pregnant, and the excitement is bubbling over. But then you realize, oh wait, I have to go to these prenatal appointments. What even happens at those? If you're anything like I was, you might be feeling a mix of joy and anxiety. Don't worry, I'm here to break it down for you, so you know exactly what to expect when you walk through those clinic doors. First things first, let's talk about scheduling. Your doctor will usually want to see you pretty early on, often around the 8-week mark. This is when they'll confirm your pregnancy and start gathering all that important information about your health and your baby's health. You might be asked a million questions about your medical history, family history, and lifestyle habits. Don't be surprised if they ask about everything from your diet to your exercise routine. It's all about making sure you and your little one are in the best shape possible. Now, on to the good stuff. The ultrasound. If you're lucky, you might get to see that little heartbeat flickering on the screen during your first appointment. It's a moment that makes everything feel so real. You might even get a picture to take home, and trust me, you'll want to show that off to everyone. It's like the first glimpse of your little miracle, and it's absolutely magical. As your pregnancy progresses, these appointments will become more frequent. You'll be going in every month at first, and then every couple of weeks as you get closer to your due date. Each visit usually starts with a weigh-in and a blood pressure check. It's like a little health report card. They'll also check for any swelling or signs of complications. It might feel a bit like being on a reality show where you're constantly being evaluated, but it's all for a good reason. Then comes the fun part. The questions. Your doctor will want to know how you're feeling, both physically and emotionally. Pregnancy can be a wild ride, and it's normal to have all sorts of feelings. Don't hesitate to share your concerns or ask about anything that's on your mind. Whether it's about morning sickness, cravings, or even the weird dreams you've been having, your doctor is there to help you navigate this journey. And let's not forget about those lab tests. You might have blood drawn during your appointments to check for things like anemia, infections, or genetic conditions. I know, it sounds scary, but it's just a routine part of making sure everything is on track. Plus, you get to have a little snack afterward, because who doesn't love a good cookie or juice box after a blood draw? As you move into your second and third trimesters, you'll start getting more information about labor and delivery. Your doctor will discuss your birth plan, preferences, and any classes you might want to take. This is when things start to feel very real. You'll talk about pain management options, what to expect during labor, and even how to care for your newborn once they arrive. It can feel overwhelming, but this is your chance to ask all those burning questions you've been saving up. And let's not forget about the excitement of hearing the baby's heartbeat, or even getting to do a 3D ultrasound later on. It's like a sneak peek into your future, and those moments will stick with you forever. So, as you gear up for those prenatal appointments, remember that it's a journey filled with discovery, support, and a whole lot of love. Embrace the experience, ask questions, and don't be afraid to share your fears and joys. You're not just a patient, you're a mom-to-be, and this is all part of the incredible adventure ahead.